Thank you. Good evening to all, and a warm welcome to all the homeopathic doctors and students. This is our 1971 day of uninterrupted webinar or IFPH. Actually, sir, there is some internet problem, I think.
Can hear you. Carry.
Oh, okay, sir. Uh, this is our 1971 day of uninterrupted daily webinar of IFPH. Today is 23rd January 2026, and IFPH aims to reach every home and promote homeopathy to fulfill our aims and objective. We have been conducting the Zoom webinar since 2020 for 3 hours in three different languages: Hindi 7:30 to 8:30, English 8:30 to 9:30, and Malayalam 9:30 to 10:30. And today's our guest is Dr. Prakash Rao. He is BA PG Rehabilitation, MD PhD Homeopathy. Sir is retired research officer from CCRH, Government of India. He has more than 30 years of experience at CCRH. He undertook projects with UNICEF and AIDS Control Society, and his today's topic is superflu spreading and its homeopathic management. And Dr. Prakash Rao sir is the person who presented the maximum number of research papers. Sir, you can continue. Sir, you can start your presentation.
Yeah. Okay. Thank you very much, Dr. Dhanesh sir. Thank you very much to Dr. Krup sir, Dr. Others who are my friends there. Can you see my slides, sir?
Yes, sir.
Yes, sir. Yes, sir.
Now I will start from first slide. Yeah. What is influenza H3N2 surge in India 2025? We have passed 2025. Even in 2026, we have a fear of endemic, epidemic, and pandemic infections of various types of viral infections in India. This was predicted by WHO. So now we will go slide one by one. Now, what is this influenza H? Influenza A H3N2. So let us go superflu. This is known as superflu. What is the difference between flu and superflu? Superflu, it is not an endemic, but it will affect in the sense throughout the world, and it is not responding to common medication. And the serious conditions, the complications that are going to develop, and with that complications, the vulnerable group that are children below the age of 10 years and adults above the age group of 70 years are the victims of this particular flu, and they are bound to develop complications. Now, I heard last week speech and everything about, but why this is superflu is the sense total world has been affected, not responding to common conventional medicines. See, we should not hesitate ourselves when we talk about the science. Science is something different from scientific approach and the scientist. So science will be always true. When the total world talks about the science, they never consider homeopathy or Ayurveda that is existing because science is a science. Or allopathy, they never think of drugs or doctors or physicians or anybody. In that, the homeopathic system of medicine is not up to the mark to compete with the modern science. This one homeopath has to agree. And for that, we have to work out. We should not feel disgusted or disappointed. We can work, but we haven't worked out. We took it as granted because 2050 years back, the system of medicine development in allopathy or in conventional medicine was different, in homeopathy was different. The concepts used to command in those days. Now, no more concepts. It is only a clinical outcome and knowing. See, just you have to show the results, then how the results came out. This is entirely different period. So we were not in a position to conquer that position. Now, previous talk also I heard about the CCRH work because I worked in CCRH. Despite of hard work being done in CCRH, the WHO has not recognized and we haven't improved our position in the society. As the population in the large group is going up, the homeopathic usage has increased. It has been accepted by the people, but whatever the accepted and the hope that people are having, the homeopathic researchers are not in a position to deliver the goods for the people who believed us and following the system. So these facts we have to always self introspect and we have to work for that. See, we have various concepts. See, animal proving we criticize, but we treat animals. And when the animal proving chance came in 1965, we never took up because in those days homeopathic scientists were afraid that they never produce any effects. So they don't want to take up the risk of proving on animals. Now it became a fashion to test the homeopathic medicine on animals and treating the cows and domestic animals and telling and publishing a paper. So what is this double standard is really not understood. Let us not to go into that topic, but let us talk about superflu. So each vulnerable population, children below the age group of 10 years, adults above the age group of 70 years, and pregnant women. So annually around 3 to 5 million, that means 3 lakhs to 5 lakhs people, see 3 to 5 million in the sense 3 crores to 5 crore people are suffering and around 2 lakhs 90,000 to 6 lakh 50,000 deaths from a seasonal flu are occurring worldwide. This is not only in India, throughout the world. But where the deaths are occurring, the deaths are occurring in South Africa because the health system is underdeveloped. They never come across and anti-allopathic attitude or you can take it anti-medicinal attitude. See, whatever that comes. In the same fashion, in India also, the anti-allopathic attitude, the allopathic doctor is a bad person, but the science and technology is very good. So we have to understand each other. So their mentality, because they have confidence, they have the proved drugs. See, even counter cells, a paracetamol is a paracetamol that decreases the temperature. But you cannot do that with Econite and decrease the temperature. See, a drug on counter cells also works because it is highly proved. We never worked out like that. So we should not hesitate of competing. We unnecessarily should not compete with any other system of medicine. We have to see that how our system will work and what best we can do. So what is AH3N2 is one of the prevalent subtype of flu. Now let us go. See, included in biannual reformulation of the flu vaccine. See the vaccination. We homeopathic theory is again is the vaccination, but the homeopathic theory is similia similibus currenter is nothing but a style of a different mode of action of vaccination. That similarity is cured. There, that similarities will prevent. Here, the similarities will cure. The law is same. So nowadays, before criticizing vaccination, we have to also see the vaccination efficacy, particularly in polio, the eradication of poliomyelitis. And we are nowadays we don't see any handicapped person, the spending and handicapness. So these are some of the things before. So the money making is only in America because America is a free country. But in India, one cannot make money out of these pharmaceutical companies. They only do the plagiarism or they can produce the duplicate drugs and the original product and they can sell, they will be caught by the institutions and they will pay heavy penalty. So that never happens to our India. Let us study the AH3N2 in conditions with our Indian conditions and with our homeopathy, what we can do. So overview, whatever the flu surged in 2025, because this topic was mentioned for 2025 last week in the month of December, but we are talking in the month of, don't confuse about that, because the flu and virus is also going to affect in 2026. Significant rise in cases in the month of September, October 2025, more severe than typical seasonal flu. The flu comes, flu goes. So the flu that is being affected by the virus, and we are the persons that are being targeted. So when the target increases, when we complete our threshold, naturally we are bound to become victims. Otherwise, the flu is nothing to do. We can take symptomatic relief medicines and we will get cured. But when it goes for complications, it becomes very tough. Therefore, it is our duty to cure the flu totally with homeopathic medicines. Major concerns across India. What happens in India? We until and unless we have been threatened, see, the half of the coronavirus has been controlled only just methods that have been followed, hygiene and contact. It is not that there is a medicine present in any system of medicine. And they see the claims that arsenic has been given, that was distributed like a placebo by the government institutes, and no studies have been completely convinced. And the arsenic paper, where the studies have been conducted by CCRH, the original arsenic paper, which was published 16 years back, has been withdrawn by the particular journal. So the backbone of the arsenic studies have gone. So people will tell that it has given results and everything, but nothing is confirmatory. But corona has gone. Somehow we suffered. In every village, a family has disappeared, and something happened. It is known that it is a biological weapon that has been prepared, that came out because of diplomatic relations, and it killed various people. So we need not talk about that. We are concerned about our country. Then there are 4 types of influenza. See, because talking about influenza or the viral that is affecting the 2025, what you call the major flu is A, B, C, D. It is divided into A, B, C, and D. What is influenza A and B viruses causes seasonal epidemics, and C and D, they cause chronic diseases. C, hepatitis B, seasonal epidemics. This influenza A and virus B causes seasonal epidemic disease, people known as flu season, almost every winter in the United States. Why this became a problem, blowing out of proportion? For Indians, the flu is a small thing because we have 1.40 crores of population. But if a problem arises in America, it is a problem. Otherwise, it is not a problem, because their dominance, their care, their fear, and their selfishness will make everything blow out of proportion, because they are highly rich. So they dictate the terms. And we are geopolitically, we are seeing what America is doing, and nobody was in a position dare enough to speak the truth because of the diplomatic relations. We have to protect our country. In the same fashion, this super flu also became blowing out of proportion. Our doctors are technically highly qualified, either conventional MBBS or homeopaths. They are two professionals, so they can control any types of disease. Particularly, the corona is the best thing, where our doctors, including homeopaths, have worked together and controlled many complications of the coronavirus. Whether whatever it may be, the studies are sufficient or insufficient. Even in conventional medicine also, the vaccine can't be prepared less than 5 years. Now only the vaccine came out, but by the time the coronavirus disappeared. So in the same fashion, whichever the problem comes, that is in the United States, will become more. Now diabetes, hypertension, now open heart surgery, because they educate only on that. They are very rich persons. They removed most of the infective disease conditions. We are the developing country and we are now only developing. We are also going in the same state where the diseases are, infective diseases are day by day coming down. So both H1N1 and H3N2 can cause severe illness. The flu, the swine flu, the bird flu, these are the flu conditions what is the bird flu? Why it became popular? Because the pet birds, they are very common in America. Here, pet birds, particularly hen. So bird flu may come to chicks and eating chicken is more here. There, the style of eating is entirely different. Here, the style of eating is we are highly developed in the form of our culture. So, cultural development has made us to develop our own methods of cooking. So, here the chicken and mutton eating is more. So, the bird flu may spread. And henny flu you heard about 2 years back, and swine flu around 5 years back. Now, last year, the H3N2. H3N2 is often considered worse for old adults, causing more hospitalization. See, usually nowadays what happens, the India is the second largest capital, everybody says, after China and America, in diabetes mellitus. And diabetes mellitus will cause complications. Definitely it will have a metabolic reaction. This is all because of cholesterol, and cholesterol ultimately, they have genetic relations. So many people will claim on YouTube that they have cured. No, it is not like that. It is bound to produce complications. Those complications must be stopped. And emotionally speaking, with homeopathy, see, everybody talks about homeopathy, but how many inpatient homeopathic hospitals are functioning in India? India is the only country where homeopathy and Ayurveda are highly developed. But how many inpatient hospitals are serving the patients like All India Institute of Medical Science or Jipmer Hospital in Pondicherry? No hospital. See how many hospitals are, if they are working, how many they are taking the conventional medicine treatment. Why we want an appreciation? Why we want a guardianship of conventional treatment? Suppose if you take Kottayam, there is mental ill health, there is a research, psychiatric research institute from Central Council for Research in Homeopathy. The psychiatrist is needed there just to diagnose and to certify that this is a case of schizophrenia. At the same time, there should be guardians when the acute phase of the chronic illness comes. There, the homeopathic prescription was not studied. The enough research was not being done. It is being carried out. We may get results in future, but at that time, the allopathic doctors, the conventional treatment help is needed. So they take that help. We should not forget these basic truths, and we should not overclaim. We should be always positive attitude, but positive attitude doesn't mean blowing out of proportion. So severe symptoms like high fever, prolonged cough, and pneumonia. Whereas H1N1, like in 2000 pandemic strain, see this Guinea flu came in 2009, historically imported younger generation, whereas the H2, H3N2 will affect more the adults, in the sense senior citizens as well as younger generation, the children and the pregnant women. So people are in more caused significant respiratory and gastrointestinal issues. See, H3N2. What is this H3N2? See, everybody talks guinea flu, influenza, swine flu, bird flu. What is this flu? What it stands for? See, we have to study that. One has to know the fundamental, the virology. We need not be a specialist in virology, but at the same time, we should know at least the definition of the viral impact. So H3N2 stands hemoagglutination type 3. H3 means agglutination. That is a full name of H. H means hemaagglutinin or hemagglutinin type 3. Type 3 is the type variety of the virus. And neuraminidase. Neuraminidase is N2. That is the second variety of the virus in neuraminidase, referring to specific surface protein. They all are proteins. The protein is the only product that will have the life in it. That's why this was understood by our previous ancestors in our civilization. Protein, the word according to it is a Latin word. If we see the architecture, or if we see the origin of the word, if we go through anthropological nature, we will find that, or the calligraphy, the protein is nothing but the Prakriti. Prakriti is the shape of nature, and nature is the fertility. Fertility is the woman. So everything with protein. The life that is present means that will have protein. So we know the protein is the Shakti, protein is Prakriti. So these all converted into lifestyle modifications, and they were part and parcel of our culture that has been managed. Somehow the reasoning has been lost. Now we cannot produce the reasoning to the existing circumstances scientifically. We cannot prove the evidence. So we can only coincide, but we cannot talk more than that in a scientific world. So neuroemergence type 2, referring to specific surface proteins, and influenza A virus, a common cause of seasonal flu. These proteins help the virus attach and spread between human cells. What this protein is having a specific condition is every cell is having a protein cell in human body. So these proteins and proteins interaction, they will be absorbed into human temperature. This virus will spread through air, through cough. This is an airborne infection. If we travel in a bus, if somebody cough without protection, without mask, it will spread into air and it will travel up to around 1 kilometer. But within the radius of 2 meters, it will spread. And whoever is having autoimmune mechanism weak, that is susceptibility in homeopathy, who are susceptible in immunology, they're definitely going to get this protein into their body through airways, and that protein, if mutations will take place, and he will be the victim. So naturally, if 10 persons are there, means there will be 7 persons, they will be affected with the super flu when they are in public places. So from public places to street, from street to home, and home everybody will be affected. So that super flu became a common among the doctors and clinics in homeopathy and in allopathy everywhere. So when it will have effect over the economy, then only the burden of the patients will be understood. Why so many people are coming with fever, then only the science will take into the cognizance and it will work out. It has been found out that super flu came, the negligent Americans or high-handed Americans or arrogant Americans, they spread everything everywhere. See, the coronavirus was also not taken seriously, and they became, various people in America became victims worse than the South African countries. And at the same time, they boast so many things that they are very forward, but their mind attitude is highly adamant. So the hemagglutinin, a protein that allows the virus to bind and enter the host cells. See, that is agglutination. Agglutination, it will have direct connection with the blood proteins and particularly WBC. And WBC will produce antibodies against it, and the antibodies will convert into disease condition, and they fail, it will convert as a pus, and naturally the disease will enter. Another protein that helps new virus participate and escape. What happens? The neuron makes flu. It will fool the total body mechanism, and it attacks into the body, and it will produce the symptoms. So the other strains are H3N2, an endemic in pigs, the swine flu, influenza, birds. These all I told previously that these are the some of the effects, and these strains will affect. So now you understood what is H3N2 full form. Hemagglutinin, a protein that allows the virus, other protein that helps. A combination of these two will affect the body. So everybody will discuss, including most of the conventional doctors, MD doctors also do not know that the full form of H3N2, because they are not well versed with the virology. It is not their defect, but the minimum virology knowledge is must for a doctor. So influenza a virus subtype, H3N2 is a subtype of influenza A virus. Some human adapted strains, AH3N2, are endemic in humans are one cause of seasonal influenza. Other strains, AH3N2, are endemic in pigs, and subtypes of IAV are defined as combination of antigen. So when the combination of antigenetic, what is this? A host, first the antibodies will be created, the antigen enters into the body, there will be a quarrel, and the body surrenders to the disease. Only 2 to 3% will escape out of 10%. That they will escape because of psychoneuroimmunity, where the concept of the philosophy has shown long back. The homeopathic philosophy has stressed that everybody won't victim of every disease, that is known as psychoneuroimmunity. And the same psychoneuroimmunity is the moderate, latest immunological concept. So out of 10 people, 7 people will be affected with the flu and the influenza A virus subtype. Now we are entering into the virus classification. What is classification? It is a virus. It is not a bacteria. It is not a parasite. It is not a protozoa. It is not a something that is coming from food product. It is definitely a virus that is having protein, that is having life. So what is really? That is Ribovira. What is the kingdom? Arthronavere. What is the phylum? Meganarivericota. See, what is the class? In Istona virusites. What these all are Latin names because there was the WHO, the Geneva Conference, the first Geneva Conference has agreed to write all the medical terms in Latin terms instead of Sanskrit. There was a big discussion whether Sanskrit, Greek, or Latin has to come. So they decided that Latin will be the correct language. It was universally accepted according to the Geneva Conference. See, every Latin word will be a diagnosis. Whoever invents, their name will be added in a small form. So these Latin words pronunciation will be very difficult. So order is RT Culaviricales. Family is Arthomyxoviridae. And genus is Alpha influenza virus. Species is influenza virus. And serotype is influenza A virus. Subtype H3N2. So this is the qualification. This is the classification of the virus. Now strain. Influenza virus is A, H3N2. What is H? Hemoagglutination, neurulema. And the main driver of the infections is known for higher mutations rate. What happens when it enters into the body? The mutations will quickly take place. In the sense, within 24 hours, the total body will become a viremic state, and there will be a temperature, sore throat, headache, cough, everything. So subclad K variants detected, and everybody thinks that these viruses are getting fever. These are the olden theories in before 1947 or 1950 that getting a fever is the reaction. That's true. But in a healthy human being, any virus, any produce. So it was thinking that temperature, fever, and something, the probacteria are coming up. We have to develop resistance. We have to develop, see, it is a toxicity reliever. No, in body is like a temple. The each part of the body, including skin, hair, nails, everything, to liver, heart, and mind, they have their own lymphoadenitic system, and they create their own life. And there is no toxicity present in the body. The toxicity is only disease, and there is no question of cleaning. There is no question of purification. There is no question of, see, they are as pure as God's. Kidney is as pure as God. See, it will first filtrate the sugar, creatinine, and it takes whatever creatinine that is needed. Creatinine is one of the protein where it keeps the muscle built up, and thus muscle built up is needed, and it will take back and return back rest of the protein and creatinine in the urine. So one of the fantastic functions, the heart that never takes rest till we from the birth to death. So these are some of the qualities. There are no toxins. There are no detoxification of the body. There is no such thing like that. The body is always pure, and the body is a gift by the nature or by the God. It is always divine, and body won't become impure until and unless it is being affected by the disease. And this disease, some of the diseases, they have been converted into RNA and DNA. They changed hormones. From hormones, they changed the DNA. There from DNA to they changed the genes, and these genes will again transform into the life through sexual intercourse. And epigenetics, the environment also plays most important role. That also changes the genes, the epigenetics, and the life that is going to the uterus. They will fertile, and ultimately the diseases became genetic, and genetic modification is coming up. So there is no detoxification. There is no such word. Getting flu or getting fever is a good. Getting headache is good. No, everything is a symptom that is being produced by healthy human being. Again, is the antibodies and antigens, a quarrel between immunodynamics of the body and the health and disease. And we have to support the health, and we have to cure the patient. We have to give medication. Then only he will come out of those circumstances. Otherwise, hospitalization, economic burden, and seriousness, viremia, bacteremia, septicemia, and they will become the victims. So we have to always should be careful. So severity illness, more intense symptoms, longer recovery period. What is this flu symptom? What is this eye flu? What is this super flu? So this is more intense into the symptoms, longer recovery period. It is not like that flu that will go disappears within 3 days. No, it takes longer periods because the vulnerable persons are old persons and young, where the 10 years old boy never develops the total immunomodulation and the total ossification of the bones, total muscular development. So he will be the victim. The pregnancy woman feeds other person, so her body goes only feeding the fetus. So she will become another vulnerable person. The old person, where wasting the old age disorders, particularly degenerations, will take place. So they will be the other victims. So they don't get support from their own body, and they will become victims. So frequent hospital admissions. Why this was studied? Because the super flu made everybody to admit in hospital for 1 day or 2 days, because the septic condition is so much that they are forced to admitted in hospital, because the old age means either they will have degenerative condition, or they will be hypertensive, they will be diabetic, or there will be some CKD, chronic kidney failure, or there won't be any disease but muscle wasting will come. There will be some disease in the eyes, the cataract, the conjunctivitis. There will be some degeneration in the body, and that gives for host to develop in their body, and severe respiratory involvement will come. Naturally, the lung function will come down as age increases. Naturally, when the lung function comes down, there will be COPD settles in the body. When COPD, chronic pulmonary obstructive disorder will be present. So obstructive disorders will be present. When the chronic obstructive pulmonary disease is present, when this virus also goes and affects, the lung function will come down. There will be breathlessness, sore throat, and nose block. Usually an elderly person above the age of 70-75 was forced to be admitted in the hospital for oxygen and for the relief. So common symptoms observed: high fever up to 104, persistent cough. The cough never comes down. It mimics like a chronic lung disorder, particularly malignancies. So the cough, that cough also increases after sleep. We have wonderful medicine for that symptomatology. And there will be sore throat. It will be more in the eyes, particularly the eyes between the pupil and behind the lens. There will be a pinprick headache, like what the bryonia symptom is present. So headache is most important. There will be body pain and extreme tiredness. Sometimes, if the person is taking a diabetic, anti-diabetic medicines, they will also develop nausea and diarrhea in some, particularly to relieve the flu instantly. So the children, elderly, pregnant women, people with chronic disease, CKD, chronic disease, chronic kidney failure, pulmonary obstruction, peptic ulcer, cancers, malignancies. So the people with chronic diseases, they will be the first targets of this flu. So they have to take the precautions, whatever that are needed. So the rapid viral evolution, fast mutation takes place. Subclad K variants. K variants means one of the variant A, B, C, D. So K, it will mix with K variants in the body immunomodulation that I will show you. But it is very tough until unless we study immunology. We can't understand. But however, a preliminary study which we made, I will show you. So reduced protection from past infections. What happens when it will enter into C clad? See the past itching, the past disease that has been cured are suppressed. What is cure? Disappearance of signs and symptoms for more than 3 years is known as cure. The challenges for immunity and vaccines. The vaccine never works. See, everybody says the vaccine never works. The vaccine protection for except poliomyelitis and the other vaccines are only 54% effective. So naturally, the 46% of the people will have recurring infections. So those 56 only will be protected. The vaccines fail. I have taken flu vaccine. I have taken diphtheria vaccine. But when the body, whether the vaccine is effective or non-effective, there is no gadget, there is no sale. For the population like India, we cannot take whether vaccine is effective or not effective. We have to give everybody. We can control the side effects of the vaccines very easily rather than not taking and controlling the disease. Suppose if the 46% of the people out of 100, if they are not responding to vaccine, they may get the disease. But the 56% of the people will get immunity. And if they get immunity, so at least the burden on the government, burden on homeopathic physicians, burden on conventional doctors will come down. That is the theory of vaccination. In America, everything is involved with money, and money only rules them. Money will be in their mind. That's why the geopolitical situation today. But money and science never go hand in hand. Science is something deals with the truth, and we will understand that. We will go for next slide. Okay. The widespread infection. What is geographic infect? High household transmission. What happens? We brought this from a bus or from train. Somebody has gone to foreign countries. He came from there and he will be a VIP. He invites everybody. He conducts a meeting. Then he spreads. From that meeting, we will come out. Then we will spread that into streets. After streets, we will spread that into household transmission. The major impact in Delhi NCR, because you will find the same mentality, high-handed mentality in Delhi as well as in America. Don't think otherwise. These all are archaeologically proved theories, sociology articles are present. Self-centeredness, except self-centeredness, most of them. It is not that there are no good people. There are good people present, but they won't be useful. Even the country which culturally having so much arsenal, so we are so many good people, but we are the victims of so many bad things. So we can't help it. The urban clusters affected. This is the reason, because the mentality that makes everybody to get bad things. So we cannot control media, we cannot control unscientific attitude, we cannot control the social injustice, we cannot talk also. So a good person, whoever can't do anything, will keep quiet what he can do. The revolution automatically comes. Whenever it comes, we do not know. But till that time, we have to wait. So we can only read, understand whatever that is in our vicinity, we can prove, we can cure, we can do that. That is the only our culture has given us. So with that, we are substantiating ourselves. We never depended on government rules. We have our own moral values. That moral values kept us and brought us to up to this extent. So it is not the police constable standing for everything in front of us or behind us to carry out our morality. See, the people are highly moral. People are following that. And see, injustice will happen, we can't control. In the same fashion, the geographical impact will have particularly the effect over the health also. And prevention measures. First, use of mask in a crowded places. It is not to get the disease. At the same time, it is not to give the disease. Hand hygiene, washing the hands. It is a simple technique. If we teach somebody, our culture gives washing the hands, feet and everything, not wearing the pant, changing the say keeping the chappal outside, everything very good culture, but we never implement our own culture. It is a fashion, and one gets very good name if he criticize anything that is classical. You criticize anything that is good that was being followed, and he will become more popular person. Avoid touching the face. Unnecessarily, we should not touch the face, particularly the children, because the hands will have the total viremia, virus will be present. We have to wash. That's why in olden days, where delivery used to be present, a child, we have to enter means we have to wash our hands. See, that is being followed. Even if we go to village side of particularly in South India, Kerala, Tamil Nadu, Andhra, everywhere we will find. So social distancing, everybody uses, they never used to sit except sleeping, and they used to do everything, daily bathing. These all habits came in our culture only to prevent these epidemics. So, medical management, early medical consultation, antiviral treatment. Why I am talking about antiviral treatment being a homeopathy? Even the homeopathic medicine for antivirus has to be thought of. See, gone are those days, how the disease is coming is well versed, and how the disease is being controlled. What is the defect with homeopathy? The homeopathy fails. The physician do not know why homeopathy failed, and homeopathy will be successful. The physician can't reproduce it and explain it why he is successful. That is being not done by CCRH or by anybody in this world. That's why the WHO a conditional acceptance has given. There is cure, there are results, but the physician do not know how the results are coming and how the failures are coming. So this study was not done because we have various lacunas. The lacunas one day has to be, we have to arrange a separate seminar for that. So this is one thing. And monitoring warning signs. We have to give warning signs. We have to tell to the patients who have been affected, please don't move away from home and you don't spread the disease. Until and unless there are 4 days are over, don't come away out of from your, and confusion. Persistent high fever. What happens when fever comes? There will be confusion because of persistent high fever. That confusion will create so many things. He will take so many treatments, and many people will say that it is not a disease, it is a disease. There is nobody in this India who cannot tell astrology and who can't give medical advice. See, you ask any normal person, he will give one medical advice. Take this herb, you will be okay. And take this diet, you will be okay. And he will tell that today is a Tuesday, Friday, it is not good, it is a good day, it is not a good day. So these are the things, the persistent confusion, high fever, and quackery without see. Everybody says, we do not know, and nobody accepts in India that I do not know. But he will tell that this is a good date, this is a good medicine. But though he is not a clarified doctor in that, but if he asks for cancer, then he says immediately you kindly go to hospital. So these are some of the human relations in our India, typical, and at the same time we have to adjust with those things. And homeopathy for superfood, a holistic approach. Now we understood the classification of the virology, then we understood what is the virus that affects, then how it enters into the body. That also will come in future. The homeopathy is considered by some as a complementary approach aimed at symptom relief and immune support. See, when the conventional medicine also gives symptomatic relief, the homeopathic symptomatic relief, they will go specially, and the same time, everybody feels it relieves the symptoms. It is symptomatic based. As far as superflu is concerned, the allopathic system of medicine, Ayurvedic system of medicine is also, their approach is not against the virus, because according to them, there is no medicine to kill the virus. But according to homeopathic conclusion, we can kill the virus by mutation. We can develop the WBC. We can create antibody mechanism in the body, and we can create the death of the virus through our own body, which they never believe that we are seeing in action. That also I will show the research which has been carried out, that has to pass to them, then only they will observe. So if the homeopathy is more successful, it will be taken away by allopathic doctors. See, most of the allopathic doctors, they write tuja for corn and tuja for warts. Most of the dermatologists will prescribe because it is effective, so they follow it. it is not effective, they criticize because they do not know anything. They don't want to know also because they are confident of their medicine. These are some of the defects of allopathic doctors. So remedies are selected based on individual symptom rather than the disease alone. See whether disease alone or disease not alone. We don't have any other mechanism except selecting totality of the symptoms. Our methodology is born on like that. Even without that also, see, we are treating the cases that are in veterinary science. What is the disease alone if we have, what we have totality of the symptoms we have taken? What is the disease that has been diagnosed? We are asking, we are asking any symptom, how we are treating the pediatric cases, how we are treating, applying our research into agro-homeopathy. So these homeopathic people who will tell, they boast out of proportion that they will treat individuals rather than disease. No, it is the disappearance of the disease which we nomenclature, whether our approach is on the disease, on the patient or the individual, that no patient bothers. It is only our weapon, how we will throw our arrow on the patient and how we will get success. So we can't prove that we have individually prescribed. They will ask for taste, see how the taste and desires for desire for egg things, desire for sweets. So after treatment of the disease, whether desire for sweets has disappeared or increased, or thirst for water has increased or disappeared, nobody has shown, including the case series. Even in one case present that has been by CCRH or also has not in a position to tell that their desires have increased, desires have decreased, or the thirst has increased, they only cured the FLUE, and any case presentation, they only cured the warts, they only cured the migraine, but they could never cure the individual of their habits or smells or desires and aversion, something. So it is a big topic, we may not go into controversies. Let us concentrate on superfluous. So commonly used homeopathic medicines. See, everybody said arsenic. Arsenicum is wonderful medicine because it is a toxin. Number 2, aconite nepellus. See, I heard of when aconite nepellus, I heard of the previous speaker that aconitum, some other group has been formed, and after that, the patient has developed right bundle blank black. No, it is not the right bundle blank black because this study was done 15 years back. Because I have written review, so I think that it is my responsibility to talk about that. The right bundle blank branch is a disease that comes by birth. When the heart matures at the age of 14, 15, the total ossification takes place. The heart will have developed and it gives right bundle branch black. And the right bundle blank branch is not a disease. Many people will continue to live even after 90, despite of the stroke, despite of the agglutination in the arteries, because of thromboemboli, because of stroke also. So right bundle branch, it is the ECG that has been decepted. The ECG mechanic was changed, so that has shown. My former speaker, I heard that I want to rectify, but I got an opportunity here, so I am rectifying. Don't think, because 15 years back I have written a review for that. So right bundle branch is a by birth disorder. It is a congenital defect which never do any harm to the heart. So aconite nepellus, sudden onset, fever with anxiety and restlessness. One can manage stroke patients with aconite nepellus. Stroke, particularly stroke hemiplegia. And aconite is wonderful medicine. That's why, with knowing or without knowing, aconite became chronic of sulfur. Sulfur is a deep acting remedy. Aconite is a superficial remedy. But don't think that aconite will act superficially. Aconite is having wonderful symptoms. If you have aconite in your chest, you can control around 35% of the chronic disease conditions, and you can save a patient like Carbovich. So arsenic album is extreme weakness, restlessness. Why extreme weakness will come? Extreme weakness will come because of high bacteremia, high viremia, high what you call the susceptible septicemia. Septicemia, what happens? High viremia, the WBC count will increase. When the WBC count will increase, there will be a decrease in the platelet count. When the platelet count is less, there will be severe weakness, and that severe weakness is a symptom of toxemia, or a symptom of what you call a sepsis, a symptom of septicemia, and that's why it will produce, and restlessness because he knows something is happening, and thirst for salt sweeps because if he takes more little water, he will pass urination. Each urination will continue with burning and a feeling sensation that he passed urine, so that the WBC that has been formed in the pulsates will disappear in this. So this is the pathological action of arsenic album. Aconite nevertheless, fever sudden onset, and the anxiety will come, the restlessness will come because the blood flow to the brain will be more. These are the pathological actions and physiological actions of this drug. The other drugs are bryonia, dry cough, body pains, and irritability. Gelsemium, chills, dizziness, heaviness. Naxwamica, nasal congestion, sneezing, and irritability. Here I haven't mentioned one very good medicine that is again acute medicine, that is inflammatory medicine, that is belladonna. So intentionally I haven't written to find out where belladonna fixes. Belladonna symptoms also sudden onset and sudden symptoms, sudden inflammation, and the patient will go delirium and he will utter in acute disease conditions that will come from viruses, bacteria, particularly in superflu, influenza, flu, fever, even some of the injuries, and some of the viral infections, chronic viral infections like encephalitis. So we have to always should not forget the belladonna. So what are the clinical features? Biological correlation, aconite-based modulation. Now I told about aconite. And what is the research I have done on aconite? I will tell you. I made a table. See, sudden fever, early innate immune surge. The what is biological correlation? Early innate immune surge. Innate immunity is a immunity developed by the body by birth. So that innate immunity will surge. The sudden fever and chills, it want to control. It want to kill the antibody. Antibody will be produced. The antigens will come. When the virus enters inside, the innate immunity will quarrel with this. And aconite-related modulation is modulates 80 cytokines signaling via NF and K beta MAPK. What is MAPK? I will show you. What is NF? See, these all are human necrotic cells. So the necrotic cells will signal and it will bind the innate immunity that has taken place by birth, and it kills the virus by producing antibodies. Killing the virus is not possible in conventional medicine, that is in allopathy, but killing the virus through our innate immunity, that is by birth immunity through aconite is possible. So body aches, malaise. The what is the biological correlation in aconite is cytokine driven systemic inflammation. When the virus enters into the body, it will produce body aches and malaise that is fatigue. So ultimately, to relieve these symptoms, the other symptom that comes because there is some virus present in the body will tell that there is fever and there will be chills. Why chills will come out in fever? When the fever reaches 104, there will be a thermal center in the brain. That thermal center will give a signal to the body that it has reached 104 temperature. So at any time meningeal layers may burst out. So the environment around us will become cool because the environment will have water vapors, and there will be density of vapors in the environment. So that will touch our head. Naturally, what happens? It produces chills because the body will cool down. When the body is increasing, so naturally the chills will come from thermal centers. That's why in any temperature that increases in the body, what happens? The reaction when in winter season there will be chill outside. When we take bath, we will have rigors. That means our body is producing heat. In here, what happens? The heat that is present in body will cool down. That's why we will develop chills. So the restlessness and anxiety, that is neuroimmune stress response. First, body aches and malaise, cytokine driven systematic inflammation. It reduces excessive cytokines expression. And the restlessness, anxiety in aconite, the neuroimmune stress, Aconite's effect on sodium channels of the body. So far nobody has worked out the drug will enter into the body through 5 channels, either potassium channels, sodium channels, carbohydrate channels, protein channels, and intravenously. So it will affect, see, the sodium channels. When we take the drug, it will need sublingual absorption. We will take pills or drops. When it enters into the mouth, the sublingual absorption will take place. The sublingual absorption will have sucrose, and the sucrose goes into the arteries of the body. Immediately it releases and it will understand the sucrose will be converted into glucose. Glucose ultimately will be converted into the energy. When the energy mechanism takes place, it will enter into the sodium channels, and that will create whatever the salts that are required, whatever the proteins that are required. Everything is being prepared from carbohydrates, and there will be sympathetic activation. This is neuroimmune stress response of restlessness in aconite. Then the kind of onset of rightness, innate immunity will come, and windows for homeopathic appreciation. See what happens. There will be a window that will open, and where the homeopathic medicine will be going on acting. This is onset of after exposure, immediate onset. And this is influenza virus that will affect in the same fashion. This is where the aconite will affect. See, it is very tough until unless one is totally thorough with immunology. One can't see this. This is the differentiation. So these are some of these one. And I am having only little time. These are MAPK signaling, inflammatory cytokines, pathways of aconite, all the drugs of homeopathy. Then stage of flu, aconite, very early onset, early inflammatory stage, established infection of systematic involvement. See, aconite, belladonna, and gelsemium. These are the 3 differences. Early inflammatory stage in belladonna, very early onset, immediately the fever came. Established infection. Infection is present from more than long duration, and there will be complications, particularly urinary tract infection, that is for gelsemium. And futures, aconite, belladonna, gelsemium. Onsets, sudden, violent, sudden but evolving, gradual disease in gelsemium. Triggers, cold, dry wind fight in aconite, heat, sun exposure in belladonna, viral toxemia in gelsemium. Speed within hours, rapid progression, so built up in gelsemium, because gelsemium will produce complication. And fever, high, dry, sudden, high throbbing, moderate to high. See, 3 the different. You kindly see my slides. Skin dry, hot, burning hot, flushed, warm and calming. Sweating absent in aconite, sweating belladonna minimal or late, present and profuse. Chills marked, minimal in gelsemium. See, aconite, autoimmune sympathetic, belladonna neurovascular, central neurovascular in gelsemium. Cytokines, early cytokines alarm, amplified inflammatory response in belladonna. Cytokines fatigue, interferon mediated sickness. Cytokines will surrender and leads to complication in gelsemium. Vascular response, vasoconstriction in aconite, and vasodilatation in belladonna. That's why pupils are dilated, pupils are congestion. Venous sluggishness, whereas here veins, here arteries. So the belladonna is arteries, aconite is arteries, gelsemium is venous. Shock to thermoregulation, hyperexcited in belladonna. Here is shock, fear. Here is hyperexcited, depression and thrombosis. These are the drugs action have been found when we did it on parrots. So futures, mental state, intense fear, anxiety. The fear of death, I added. Fear of death, God never told that I have fear of death. So delirium, irritability, hypersensitivity, dullness, apathy, because surrendering to complications of the disease. Restlessness, extreme. Belladonna, restless, moderate. Gelsemium, absolutely no restlessness, because the superflu has produced complications. Sensitivity, emotional, sensory, and mental and muscular sensitivity. Aconite, these all are given in materia medica. How the materia medica language will be converted into pathology when the drug proving has been taken place over the parrots. So from shock to pressure, what happens in shock? That is the rats. When we open the door, they immediately rush, throbbing, pulsating. We can see the pulsation over the head of the rat. And heavy, dull, sudden, intense, sharp, congestive. What is my idea? Sudden, intense, sharp, congestive. We cannot touch the rat. This is sudden. And deep aching with weakness. The rat will fall down. And when achings are present, is in gelsim, which is pressed, rat feels happy. Motion aggravation, belladonna also. So
Yes.
this is my time is over. So
Yes.
these are the some of the things you can note down. And the congestion is minimal marked. And aconite, I was fine, then suddenly I am burning with fever. My head is pouring. These are the symptoms that has been converted into pathology and found to be effective in super flu. These are the aconite, belladonna, gelsemium comparison, fear, anxiety, delirium. These are the works that have been supported by pathological changes in parrots. And key takeaways: 2025 flu surge driven by H3N2, more severe than usual, rapid mutation increases risk, prevention and early care of the critical care is important. Influenza remains a serious public health threat. Vigilance, vaccination, hygiene, save lives, protect vulnerable population. Thank you very much. Thank you. Any questions? Sridharan Kurup was raising the hand. Sir. Hello.
Yes, sir.
Yes,
Really,
it was a wonderful section. He is our Research Association, ex-servicemen's Research Association's president. He is our editor-in-chief of our journal. So I thank you very much for that. I called so many people. He is the first person, calling itself. He is agreed to conduct these IAPH seminars. So thank you very much. A big salute for you.
Thank you,
Thank
sir.
you very much.
Because of you, Dr. Sridharan Kurup, sir. You only introduced me to Danesh. You only introduced me to Manoj. So I do not know anybody. And so it is because of you. Thank you very much.
yes. Yes, thank you, Sridhar sir. And it's really a very big session and good session, and really give an opportunity for us to rewind our treatment protocol for this so-called flu. And as you rightly point out, there are many reasons behind the so-called flu spreading now, and why this is happening, and everything were written on why the vaccination is not effective, and how the impact of vaccination is going to affect the community, and how we can treat with homeopathy. What are the most probable precautions one has to take, and how one can manage this thing, as it is just like any other simple viral disease we can treat, and whether it is a flu, whether it is a viral so-called mumps or COVID, or whatever may be the disease, it doesn't matter. The name doesn't matter. What matters is the patient in front of the doctor, and the symptoms you elicit from the patients, and what are the things you get from the patients, and how one can manage the patient with the homeopathic medicine. Our medicines are really excellent to bring back the person to health in the shortest possible time, as what Dr. Heinemann mentioned in Organon. Anyway, congratulations, sir, once again for coming over here and delivering a big session for us. I'm inviting Dr. Richita Trivedi to say a vote of thanks also to the session. She was the moderator today. Dr. Richita? Yeah, okay. She's not, there was some network problem. Anyway, thank you all for joining this session. Thank you, Prakash Rao sir, for such a wonderful evening, and those who attend the session also. Thank you all. Good night.
Thank you, sir.
Tomorrow we will have a session from Dr. Indrani Bavatkar, and he will be talking about the principles of MASMs and how it works in diabetes.